Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Wohler, talking with experts in functional and integrative health and medicine, discussing critical information for improving your health and wellness to help you live a long, full life. Let's get to it. Well, hello, everybody. Welcome to the Functional Medicine Doc Talk podcast. I'm your host, Dr. Kurt Wohler. And one of the things as we look back with regards to the pandemic is the discussion of the spike protein. Now, the spike protein being a part of the virus that actually allows for the virus to get entry into the cell. One of the unique things is that the spike protein actually has its own level of toxicity. And one of the things that's come about in this discussion is that the spike protein induced from the mRNA injections also has some issues. And so there's this concept of what's called spikeopathy, where the spike protein has its own pathology-inducing effects. So much of the press and the media has paid attention, if they're paying attention at all, is to spike protein problems within the heart. What doesn't get much attention is the neurological problems. And so I'm joined by a neurologist, So I'm joined today by a neurologist named Suzanne Gazda. Suzanne is a fellow within the FLCCC organization, which is the Frontline COVID-19 Critical Care Alliance. And she has a lot of experience in working with individuals with long COVID, as well as individuals who've been injured from the mRNA injections. So very interesting conversation, a very important conversation. So Suzanne, welcome to the program.
Thank you, Kurt, so much for asking me to be here today. I am honored.
So give the audience a little background of your education, your training, and then really kind of how you got interested in this particular topic.
Oh, you bet. I'm a Texan, born and raised. I attended the University of Texas, got my degree in pharmacy, went to graduate school, and then decided, hey, I want to be a doctor. So I went to medical school and did my training in neurology. When I finished that, I started my own private practice called the Neurology Institute of San Antonio, and I've been a neurologist in this community, San Antonio, Texas, for about 35 years. I love what I do. Just life every day seems to become more and more fascinating.
And one of the things in your, conventional practice is you specialize in multiple sclerosis. Is that correct?
Yeah. My focus is autoimmune mediated disease, especially MS and other demyelinating syndromes. So we've got about 3,000 MS patients, which for a private practice is a large number.
So COVID hits, right? We see issues now with long COVID, and then, of course, the mRNA injections. What are some things that you have seen since things began 3-4 years ago? And we'll talk about some nuances of, unique things that are happening, the progression, how quickly onset some of the problems are. But I'm curious what you're seeing just across the board within your practice when all of this came about, of either new onset problems or, exacerbations of underlying problems that people were dealing with.
Right. 2020, things just didn't seem to make sense to me. We were frightened. We were scared with this virus coming across continents, across the ocean, and the stories we were hearing in the media were frightening for sure. And then when the messenger RNA, the development of the vaccines was being promoted, coming out, I was very reluctant about that. It just seemed to me that we really needed to take a pause and consider this new technology, whether or not it was safe would be and effective. But in early 2021, I began to see a shift in my patients, in patients' presentations. It was unlike anything we've ever seen before, unusual presentations. And many of them, from a time standpoint, occurred after receiving the COVID vaccine. So, of course, I was very curious about that and thought we've really got to follow this closely. So by about that time, I started working with some other individuals with long COVID and tried to expand my knowledge. Unfortunately, this is a disease, long COVID, Long-Vax, that you can't go to a conference, that most physicians that understand this disease have had to learn it all themselves. And so that requires a tremendous amount of time and still does. I probably read, in addition to my practice of 40 hours of reading per week just to keep up with everything now. So in 2020, there was a great awakening, and many of us began to see things, I think, clearly that didn't seem clear at the time. And then with the rollout of the COVID vaccines, like I said, in the neurology world, we began to see very unconventional presentations. So now, 3 years later, we are still seeing that in a way that is actually interesting, but also frightening at the same time. There is no amount of knowledge. There's not enough knowledge today to explain exactly what's going on. But yes, Kurt, when you talk about spikeopathy, that is truly the pathophysiology that is provoking these symptoms, either in long COVID or in the post-vaccine injured. And the neurologists are harboring a big part of this fallout because most studies have showed anywhere from 30 to 70% of patients with long COVID have neurological problems. And the vaccine injured, according to the REACT-19 data, 80% of patients that are vaccine injured have neurological problems today.
When you look at the traditional media, they're giving some discussion towards myocarditis, but very little do you hear about things from a neurological standpoint. It makes sense that the nervous system is going to be greatly impacted because it's now known that the lipid nanoparticle technology of the mRNA injections moves throughout the body and across the blood-brain barrier. And so it's really being distributed everywhere. And this was known early on, even just with some of the biodistribution studies that were done very early on in this process. And then the thing that I think about, Suzanne, with regards to the nervous system is it's such a high metabolically active organ system, the brain nervous system. About 20% of all ATP produced in the mitochondria is going to support the brain and nervous system. So there's a lot of metabolic demand. And so, the vaccines themselves, or I don't really like to call them that, but the mRNA injection material is obviously going everywhere, but clearly into the brain and nervous system. And I'm curious what you're a specialist in, autoimmune aspects of this and how things affect from a nervous system. It's known that the spike protein, whether again from the virus or the injection, is triggering inflammation. It's now being embedded into tissue, which is causing cross, antibody reactivity in the brain. Are there certain areas in the brain that seem to be more prone to spike protein infiltration, in your experience?
There are multiple studies now describing different parts of the brain that have been affected. Of course, these are all in long COVID. We know anything that happens in long COVID can happen in post-vax, again, because it's the double-edged sword. It's all related to the same pathophysiology, and that is, what are the downstream effects from lingering spike protein? So a recent study looked at functional MRI. It's kind of a unique MRI technique. We don't really have it available in our clinical practice, but study after study, that at least that I've reviewed, shows it can be the white matter, which are the lines of communication that connect one thing or multiple things to the next. But it really seems to be the gray matter. The gray matter is where the majority of the cortical neurons are. And in this study, it showed particularly the putamen. It showed the temporal lobes, showed the parietal lobes. But as well, we know it's the hippocampus being the primary memory center. Dr. Michael Nels has talked about this in his book called The Indoctrinated Brain. And I would say his theories and philosophies should be considered because there are multiple studies now that talk about lingering spike protein, i.e. long COVID, and what happens to the hippocampus. And if you take down the hippocampus, you really can't form new memories, but also you lose a very critical piece, and that's curiosity. So it seems to be white matter, but the majority of studies, including imaging studies that I've looked at, it's gray matter. And I always say the mind is a terrible thing to waste. And it is very hard, right? Just like if you have a heart attack or you get myocarditis, it's very hard to bring those damaged parts of the brain back on board. And unfortunately, that's what we're seeing now, 2 or 3 years post-COVID infection, is we're seeing that a lot of these patients are not getting better. And we have to ask why.
So let's talk about white matter, gray matter, hippocampus. So give us an example of how something might manifest if the white matter is being adversely affected.
So it could be an MS, new onset MS. I mean, white matter is where predominant, white and gray matter in MS, but we call that demyelination. But I mean, it could also be something as subtle as you're just not thinking as quickly. Motor involvement could be involved. And I think, Kurt, this is one reason why long COVID, Long-Vax are so atypical in their presentations. I mean, everybody knows what a stroke does, right? Maybe paralysis on one side of your body, or you can't speak correctly.
Right.
But I think there's so much diffuse neuroinflammation, high levels of inflammation in the brain, so much takedown of the neurotransmitter systems, alteration of the blood-brain barrier, destruction of the lymphatic system, all of these mechanisms in the brain that are supposed to keep things working efficiently. There are so many different mechanisms of injury with spike protein, which I would say is the most harmful neurotoxin we have yet to see. So white matter, and we think about white matter involvement in patients with demyelinating events like optic neuritis. Perhaps they develop transverse myelitis with weakness from one part of their body lower into the lower part of their body. To me, that's more white matter involvement. Gray matter can be stroke, but predominantly what we're seeing is cognitive. And I think you are absolutely right. And it bothers me that, I mean, of course, we talk about death after the COVID vaccine, so many now in the VAERS system. What are there 15,000 now? And that's grossly underrepresented. We talk about myocarditis, but what we really need to be focusing on is the harms that we see going on with the brain, because I think we will see a tsunami of neurodegenerative disease in the coming decades. We're already starting to see it now.
Well, you think about the attack on the hippocampus. I mean, that's clearly in line to happen. I mean, and as Dr. Nels has described, I read his book, I've seen a number of his interviews, and it is terrifying because we already have a problem. I mean, it's a massive problem already. I've often thought, I have no direct evidence of this, I'm just suspicious of it, that we may see some of this occur even with, the rising rates of autism, because I'm wondering now if some of the same underlying neurological, I'll call it malfunctions or dysregulation are occurring, from an inflammatory standpoint, particularly within the hippocampus. So I'm curious, are you seeing sort of progressive dementia or just sort of low-level memory issues happening now in younger people in your practice?
Absolutely. Last week, I had two young women, one 39, the other one is 45. They presented 2 years ago with COVID vaccine injuries, brain fog, post-exertional malaise, weakness, fatigue. But now, 2 years later, they are PET positive. PET scans are kind of the neurodiagnostic study to really prove the diagnosis of Alzheimer's disease. They're PET positive and they're positive for biomarkers. The one we're using now is p-tau 217. So the question is, what do we do? And both of these individuals are on pretty aggressive brain recovery protocols. The one I try to focus on is called the Bredesen protocol, which again, we can talk about later, probably all the things we should be doing every day to maintain brain health. So we absolutely are. And, I don't mean to sound like some scary woman, but I don't think it's out of the realm of possibility that we'll start seeing atypical presentations of neurodegenerative disease.
Well, that brings me a question about your MS patients. So we can see where the spike can trigger adverse immunological reactivity, inflammation, cross-antibody reactivity, depending on where it gets embedded, because you're basically sending a signal to the immune system, whatever tissue that spike protein is in, to say, hey, come and get me. So I'm curious with some of your MS individuals, is there perhaps a quick worsening of their conditions? And I'm also wondering, Suzanne, is there some emergence now of kind of an atypical MS presentation? Are you starting to get a cluster of people that just like, what is this? We're not used to seeing this type of presentation.
That is so true. I think we would all agree that what we see today is more complicated than anything we've ever seen before. Jessica Rose, who has done such an amazing job with interpretation of the VAERS data, reported a few months ago that since 2021, there has been a 900% rise. Yes, 900% rise in new onset MS, an 800% rise in new onset autoimmune disease.
Wow.
And there was a study done in 2021 by Dr. Vorjani in Frontiers of Immunology, where they looked at molecular mimicry. What does spike protein look like? I always say it looks eerily like the body and the brain. And there were 28 out of 55 human tissues, and 5 of those were in the brain. One of them was myelin.
Right.
So I think, we have no idea the similarities of spike protein in the human body and brain, but seeing now the rise of autoimmune disease, including the rise in multiple sclerosis, I have to believe that spike protein is fueling a tremendous amount of this new pathology.
So when you break things down in your practice from what you've seen from a pathophysiological standpoint of how somebody manifests with a problem, because we could look at spikeopathy inducing microclotting, for example, which is going to compromise blood flow, which would then affect more classically the gray matter, so to speak. And then you've got the spike protein being embedded or being produced within a cell and then expressed on a cell surface, which would then be inducing an inflammatory reaction. And then again, that autoimmune situation. So in general, are you tending to see more, let's say, classical white matter presentations like the MS, or more of the gray matter type of situations like the stroke, the microclotting scenarios, or is it pretty equal?
Yeah, it's really both. And, remember, MRI is not going to show anything. It really isn't. I always say MRI is like the tip of the iceberg. You're going to rule out the 3 big things: 1, stroke; 2, MS; 3, brain tumor. So these patients are presenting with serious problems. Can't move their legs, have horrible balance and equilibrium. Their vision is extremely impaired. And yeah, when they look in, they come in and they're a young person, we think, oh, this has got to be MS. So, like I said, I think there's so many different pathophysiological mechanisms going on that these presentations are extremely varied. There have been studies that showed after COVID, the cerebral blood flow is decreased. And that could cause a tremendous amount of symptomatology. And we know so many of these people have an abnormality of their autonomic nervous system, which is what fuels the post-exertional malaise, the inappropriate tachycardia, the temperature dysregulation. And the autonomic nervous system is fueled by a neurotransmitter called acetylcholine. So these neurotransmitter disruptions, acetylcholine, dopamine, norepinephrine, serotonin, there's really no way we as clinicians can measure that. And I'm sure you're familiar with all of this that happens in the autistic kids, but this is clearly something that's going on here too.
Yeah, I think one of the things to keep in mind is that the inflammatory reactions don't just affect, let's say, a cell in general. They can be affecting receptors. They can affect the way a receptor binds to a neurotransmitter, the signal transduction effect that happens once that interaction has occurred within the cell. There's a myriad of things. And of course, just the dysregulation of the biochemistry within the cell is another aspect. And that's something that is being seen and well recognized even just in cancer. So William Mackus, for example, has talked a lot about some of the mechanisms with regards to the mRNA injections in oncology. I'm curious, have you picked up on individuals with brain cancer or other types of nervous system cancers and then refer them to oncology, as maybe an initial presentation of their underlying neurological problem?
We have, in my practice, I've maybe seen, 2 in the last 30 years. In the last 2 years, we've had 5. So
Wow.
Maybe that doesn't sound like a whole lot more, but it really is. It really is. I think the mystery behind all of this is why? Why doesn't the immune system take care of this lingering spike protein and get it out of our system? I would like to understand that better. Remember, there was that study by Wrong and colleagues published last year, and it showed that these were patients that had had COVID, like you and me. They didn't die from it. But then sometime later, quite a bit of time later, they did brain autopsies, and they found lingering spike protein in the meninges, the protective coating around the brain, in the cortex, and in the bone marrow. So we don't know. We don't know if this lingering toxin is going to harbor pathology over time, but we have to try to explain why this toxin is so vicious on so many different systems and why our immune systems are not taking care of it. I'd love your thoughts on that.
Well, a couple things that just came to mind when you're talking about bone marrow, and maybe some studies. We can't read everything out there, but I'm starting to wonder about stem cell, compromised aspects with the spike protein. And now you're getting emergence perhaps in the body of just, what should be normal cells that are now expressing this spike protein in their normal development. And that could be anything from the immune system to everything else. So that's a bit of a spooky thing to consider. It may be that in part that our immune system can recognize these things or has been able to recognize things from more of a natural sort of normally evolving type of viral expression, because there's other types of SARS, viruses out there. It's not just SARS-CoV-2. And so the spike protein is something that has been around. But as you know, when you go look at the sequencing that was done for this particular mRNA injections and the SARS-CoV-2 virus, how much abnormalities are in it that don't seem to be biologically natural. That means they somehow were manipulated. Now, all of a sudden, we're introducing this particular compound in a very large dose that the immune system, I think, just hasn't had a time or a chance to evolve to and be able to recognize in an appropriate way. And so I think what's happening, Suzanne, really is the mass vaccination during the course of a highly evolving virus and immune pressure or public pressure, in essence, with the virus out there, is creating this compensatory shift in the immune system and also putting pressure on the virus to mutate into more infectious and now potentially more virulent forms, that it's just created this abnormal situation that probably had to do to some degree with the amount of load essentially that was pressed upon us, both from the virus and now from the shots. So yeah, I don't understand all the mechanisms myself. I mean, I look at some of the mechanistic aspects of this from an immunological standpoint and cellular standpoint, but it's confusing. And it's just, there's so many areas that it seems to be hitting that you think you figured it out and then something else pops up. And what I've recognized in my practice, and I'm just thinking about some of the autistic kids I work with, the complexity of the cases just keeps increasing.
Yes.
I very rarely come upon a situation that seems anymore to be relatively straightforward. I might think it's straightforward, but once you start diving into it, you realize it's much more complex. And I'm sure that's what you're seeing. I'm absolutely sure that's what many of the other doctors that are part of the FLCCC organization are seeing as well, whether it's the long COVID, whether it's the Long-Vax type of scenarios. And we don't know how long this thing is going to circulate, going to be expressed in the body. If you look at some of the research on the microbiome, my concern has been, are people actually producing the spike from their own gut microbiome, like their body is a factory of this now? How long does that last? So a lot of unanswered questions. I mean, but we're fortunate in many regards that there's a lot that is known. So I think that's what's very helpful.
Well, one of the things that I follow, there's not a lab marker for lingering spike protein. I wish there needs to be, but one of the things I look at, and these can be done at LabCorp or Quest, but I look at SARS-CoV-2 IgG spike antibodies. And many times those are off the chart. Like the number would be greater than 800, meaning, we're not going to count anymore. It's so high. And to me, that means either they've recently had COVID, which isn't the case. They've recently been vaccinated, which usually in my practice isn't the case. Or number three, that genetic message has now been integrated into the permanent genetic code, and there is a constant production of spike protein, or that the original spike exposure triggered these autoantibodies, and now we have this high, really autoantibody induced disease. That's what I'm seeing and following these markers very closely. They rarely come down, Kurt.
Well, it's probably a combination of all of it, Suzanne. And then the other scenario would be for somebody maybe who isn't symptomatic and then becomes symptomatic, or maybe you do a test and you find out their levels are high, is the potential of exosome, contact, because that is a known biological entity. These exosome packages get released from the cells. They can be released in the breath. They can be released on the skin. I guess it's debatable how far they travel, but still it is a known, biological manifestation of exosomes. So that's another potential aspect of this.
Right.
And so I think, when we talk about spikeopathy, there's a lot of attention, and for good reason, on the spike protein and the different segments of it and how things have sort of moved or shifted with regards to the spike protein over time. What often gets lost in the discussion is the immunological compensation that has occurred within our bodies and within sort of this greater public health sphere in trying to combat the situation, either of the presence of the SARS-CoV-2 virus and its different variants or the spike protein in high levels. And so that's kind of another discussion, because now you're getting this immunological shift or compensation, which also has its own adverse influences. I'm curious, in your practice, what is the people that have reacted from a neurological standpoint to the mRNA injections? What is the typical onset of symptoms? Is it within hours? Is it within a few days? Things manifest in a couple weeks? What are you seeing?
In the beginning, in 2021, we saw a lot of acute onset problems, within hours, within days of the vaccine. But, the DMED, the department, the military data showed that it could be anywhere from, I think it was 3 to 9 months. So we don't know if patients in 2020 that got vaccinated in 2021 and went, oh no, I'm not getting any more, which fortunately the majority of people have decided that, they're probably going to be fine. But, the biggest advice is no more shots, no more messenger RNA technology until it can be studied in more detail. Because it is confusing. Now we have a hybrid population. We have people that have had COVID once, twice, sometimes multiple times, and 2/3 of our country was vaccinated. So what are these unusual presentations that we're seeing today that don't fit into a conventional category? The majority of them have brain fog, fatigue, post-exertional malaise, sometimes neuropathy, headaches. Those are probably the most common presentations. But if we can't find anything, do we go ahead and call them a functional neurological disorder and refer them to psychiatry? No, I think we need to follow these people long term and see if something eventually manifests.
So let's talk about the brain fog. So is that primarily occurring because of a direct neuroinflammatory reaction? Or is that occurring because of microclotting and endothelial inflammation and lack of blood flow? What's your sense of the brain fog component?
Well, I think it's both, but high levels of neuroinflammation for sure. There's a type of MRI that I do called a neuroquant. It just looks at the brain in a little bit different way. It's been around for 20 years. It was originally designed as a biomarker for Alzheimer's, but when you do the neuroquant, the MRI will be normal, but on the neuroquant, we'll see high levels of neuroinflammation throughout different parts of the brain. But definitely the vascular pathology, the microclotting, has to be the second pathological reason. And then the third, neurotransmitter destruction, especially acetylcholine. One of the ways spike protein this spike protein is different is, number one, it has a prion arm. Prions are these misfolded proteins that can lead to any neurodegenerative disease. So for some reason, SARS-CoV-2 spike protein was designed with a prion arm. And it was also designed with these, we call them protein inserts similar to snake venom. I'm serious. And so what those protein inserts do is they destroy the acetylcholine nicotinic receptors, which are very vital for cognition, for just day-to-day thinking. And I think those are the biggest factors leading to brain fog. It's not easy, is it? There's so many things to think about.
Do you know of any evidence of the spike altering certain enzyme pathways? I'm thinking something like, let's say, acetylcholinesterase, for example, or some of the other dehydrogenase reactions that occur with regards to certain neurotransmitters. I've not come across any information where you're getting perhaps just inhibition on enzymes. I mean, there probably is some evidence out there, just not knowing, but I'm not sure if you've come across that at all.
It doesn't come to mind right at this moment, but I'll definitely go back and look into that, Kurt.
An interesting thing, because you're talking about functional neurological, syndrome, and then referring them to a psychiatrist. And you actually had sent me a paper recently, about in the world of psychiatry, sort of recognizing, the onset of now more mental health issues and manifesting. They were actually talking in that article about dysregulation of the NMDA receptors and glutamate regulation. So it makes me wonder, if you start creating, not only are we triggering microglia activation, right, which is going to be a major component of the neuroinflammation, I'm wondering if you come across any information about the spike altering astroglia function, because that's going to then create dysregulation and glutamate control, and that itself can lead to problems. So, and that might even cross over either with neurodegeneration or some of the psychiatric issues. So, any thoughts there?
Well, definitely the glutamate system is heavily involved. And it is those neuropsychiatric symptoms that I think get missed 9 times out of 10. But again, this is being grossly under-recognized since 2020, 2021.
The post-exertional malaise, fatigue. So in my mind, that comes down to, well, it could be a number of things, but you start thinking about mitochondrial activity.
Yes.
And so I know one of the areas that was examined early on, I don't remember if it was the Vojani paper or one of the other research that was out there, but the mitochondria took a hit.
Yes.
As well. And so we had mentioned before, maybe I had mentioned before, as you know, about 20% of all ATP produced is going to support the brain and nervous system. Is that, I don't know how much that's recognized in the conventional world of neurology, understanding the aspects of mitochondrial problems. Is that something that was maybe inherent in your training, or something that you've appreciated more, working now more in the realm of integrative medicine? But it's a confusing area, certainly biochemically, but a very important one to pay attention to.
Yes, I would say most neurologists don't think about mitochondria in their day-to-day. There was that one study that looked at muscle biopsies in patients with post-exertional malaise. There have been a couple of studies now that I know of, and it showed 3 things. It showed high levels of inflammation within the muscle. It showed decreased blood flow. The blood vessels were actually small. And then the third component, which was quite shocking, it showed an amyloid myopathy, that this prion amyloid, which we know spike protein can fuel. A number of studies have shown that spike protein is amyloidogenic, but in the muscle biopsies, they showed this amyloid. So these patients presenting, my brother is one that has really severe long COVID. He was not vaccinated, but his symptoms are just can't exercise like he used to, has a lot of post-exertional fatigue, just, walks around the block and has to rest for a day, and then really severe myalgias. So if that's what's going on in the muscle pathology, I think, and then mitochondrial dysfunction. We really have to focus on the vascular part of it, but strong mitochondrial support.
So one of the things that's interesting about the prion component, because we know that can obviously generates a lot of neurological issues, neurodegenerative problems. And I've often wondered, although I've not come across any information this with regards to spike, but I know it's looked at in things like ALS, MS, Alzheimer's, for example, is dysregulation of the ubiquitin proteasome system, which is that internal system within the cell that helps to degrade and get rid of these old, worn out, damaged, malformed proteins. And what's interesting in some of the work I've done in the autism world with regards to dopamine problems that primarily occur second to Clostridia infections, you get inhibition of this dopamine beta hydroxylase enzyme. You get this accumulation of cytosolic dopamine that breaks down into compounds or components that inhibit this particular ubiquitin proteasome aspect. So there's certainly many different mechanisms that can be at play, but the problem is that it appears these malformed proteins can also attack or damage the mitochondria at probably multiple levels. So that's very interesting. So you're saying that in the skeletal tissue, they're having these abnormal proteins manifesting.
Yes.
Is that being induced by some sort of breakdown of the actin and myosin in the muscle tissue, or is there another component? Do you know?
I don't know if we know. I mean, we know that part of the issue with the microclots being so hard to break down, of course, spike protein attaches to the ACE2 receptors on the vasculature, on the endothelial lining, causes a high level of vascular inflammation, but also forms these very difficult to dissolve microclots, which are also have components of amyloid in them. So again, spike protein, the Nystrom study showed if you put spike protein in cell culture, not the virus, just spike protein, literally within minutes, that spike protein will transform into amyloid. So is the amyloid in the muscle coming from spike protein? I would say that's my theory. And again, once you form amyloid, alpha-synuclein, whatever the prion is, how do we, I like your idea, how do we help dissolve these proteins that are misforming in our body, but also in our brain?
That I didn't know about. That's really interesting about the spike then transforming or inducing amyloid in cell culture. That's remarkable. One last question, as you sort of went through things with regards to the long COVID or the post-vax issues of brain fog, post-exertional malaise, is POTS, or this dysautonomia type of scenario. Small fiber neuropathy is not something that I was ever trained on or thought to recognize many years ago. It's really only come since COVID that, and this whole sort of nightmarish situation, that's become more on my radar. Can you explain what that is and how that relates to this discussion and what you're seeing in clinical practice too?
We definitely see a surge of small fiber neuropathy now. And we've known about small fiber neuropathy for a while, but the studies are showing that sometimes up to 70% of patients with long COVID, Long-Vax, can have small fiber neuropathy. So when the small fibers are involved, they're everywhere. They're in your skin, they're in your tissue, but one of the things they're involved in is helping to regulate the vagus nerve. The vagus nerve is the big nerve that influences and regulates your autonomic nervous system. So if the vagus nerve is impaired, you can't regulate your heart rate. You can't regulate your blood pressure. Your blood vessels don't dilate or constrict like they should. So when you stand up, you do get lightheaded and dizzy. And, there's huge involvement of the vagus nerve in the gut. So patients get terrible gut symptoms. They can't swallow. Maddie Daguerre is an example of a vaccine-injured patient. She was in the clinical trial, and all of a sudden she couldn't eat, she couldn't swallow. She lives now, I think, with an NG tube or a permanent feeding tube. And she was reported as a stomach ache. So when this vagus nerve system, when the autonomic nerve system is taken down, and Kurt, what's so interesting about it is, as opposed to what maybe we used to see, but it's so unusual because, like with Maddie, it was predominantly gut symptoms. In most individual, it is more typical POTS, which is can't exercise, lightheaded, dizzy, syncope, fainting. I have one patient who's vaccine injured, and it's the worst case I've ever seen. She's on double dose anticoagulation, still having blood clots, is in bed 90% of the time. So what we're seeing today in regard to the dysautonomia, the autonomic nervous system, is really challenging. And then again, the small fiber neuropathy is probably autoimmune induced. Spike protein sees these small fibers and then starts to induce autoantibodies against them.
Now, is it mostly manifesting preganglionic, postganglionic, as far as parasympathetic, sympathetic? I mean, or I guess it could just be probably, like everything else, a combination of all of it.
That's what I see.
Yeah.
Yes.
What about hypothalamic issues? So we know the hypothalamus has a major influence over many different systems in the body, including the immune system. I can't imagine the hypothalamus is escaping damage.
That's a good point. Yeah. And in what way would you see that manifest?
Well, you might have appetite issues, problems in controlling body temperature. There's aspects of the hypothalamus that have an influence on immune function. So there's connections of, let's say, the locus coeruleus to things in the thymus, and so there's a lot of different areas. That's another area in the brain that's highly complex, but maybe it's just not being looked at. But you're getting just this mixture of different systems and presentations of things. It's probably just hitting everywhere.
It's such a good point, and such incredibly complex and difficult to treat sleep disorders today.
Yeah, well, that's something I've recognized with the autistic kids for many years. Some of these kids don't sleep, and melatonin won't touch it. Sometimes it works, but sometimes it doesn't. And so we could have a whole discussion about sleep. I'm wondering, with your work, the other area I think about too, and this kind of goes to the whole PANDAS scenario, is something that's discussed a lot in the special needs community, is attack on the basal ganglia. So I'm curious what kind of manifestations you're seeing with basal ganglia disorders.
A lot of these patients have a weird movement disorders. I know, but one thing that's really common, Kurt, is this hard to describe internal tremor. So many patients have it, and on exam you don't really see much, but it is a very disturbing symptom for these individuals. And all kinds of unusual movement abnormalities. They can't get around as quickly as they used to. So
what was that tremor again? How does that manifest?
And they say, I feel like I'm shaking inside.
Okay.
I call it an internal tremor.
Okay, interesting. Well, one of the other things too, Suzanne, to think about this is that I was talking with somebody the other day, is we can look at this as a new event, and it certainly was with the introduction of these mRNA injections, but it was also done on the backdrop of everything else people are exposed to, right? From chemicals to mold to mycotoxins to chronic infections to dysregulated and imbalanced microbiomes, and that maybe that's why some people seem fine. They've gotten multiple shots, even a few boosters, and nothing happens. And then others have one or two, and then they're completely devastated. So this template or this backdrop of things that we're exposed to, I'm sure plays some role. So what are some things that lab testing you've talked about? There's really not any great things that you looked at antibody markers to spike or SARS-CoV-2, for example. Are there certain go-to labs that you like to run on most patients that you see?
Well, many people will do Bruce Patterson's NCell-Dx. It looks at about, I think, 12 or 13 different inflammatory markers, and he can actually detect lingering spike protein in the monocytes. But the way I look at it, I admire his work. They've struggled to get their work out. They now have a vaccine injury study that shows this lingering spike protein in patients that were vaccinated, not just long COVID. But I don't know, Kurt, what I always tell patients is that test may be helpful, especially if we did see lingering spike protein in the monocytes. But after our discussion today, people need to understand that if it's not there, spike protein could be anywhere, right. Even the bone marrow. I try to, I'm a conventional neurologist for the most part. I love integrative, but in my practice, people don't like to pay for things out of pocket. So we'll try to get most of the lab from Quest or LabCorp. But I do see a lot of people, though, with reactivated Epstein-Barr. I see a lot of patients with resurgence of Lyme disease. And in the very beginning, I remember us having this conversation that it just didn't seem like they were clearing the mycotoxins like they did before 2020. And I wondered if somehow these detoxification systems, again, your kind of toxic load theory is very, very right on here, is the immune system just cannot handle it all.
Well, I think that's clearly happening with people who are having reemergence of things like Lyme, of Epstein-Barr, or not able to clear infections that they may have normally in the past. I mean, there's a lot of things that are happening with regards to the immune system, where all of a sudden the multi-vaxxed individual is now severely compromised with regards to their innate immune system. So that first-line immune defense is now compromised. They could have underlying candida, clostridium issues, and other types of problems. And then, of course, you're getting, sort of, I don't want to say imbalanced, so to speak, sequencing between the innate and the adaptive immune system, which is problematic. So one of the things I know, Suzanne, and as you mentioned up front, this will be an area that we'll be studying for years to come. And if this thing is incorporating into the DNA, and that incorporation is somehow being transcribed into a protein or malformed proteins, it's difficult to say where this is going to go. But aside from that, there's certainly problems, but there's also some things that people can do. And I think that's an important part of this discussion too, is action steps moving forward. So as you mentioned, avoiding these shots, now and into the future. What are some things that you have found in your practice that go-to remedies, medications, and whatnot? I know it's going to be, patient dependent, et cetera, but some things that generally people might consider thinking about or researching that may be helpful in certain circumstances. One thing that comes to mind might be something like ivermectin, but there's no magic bullet. But I'm just curious what you typically use or look to.
Yes. Well, I refer people, if they want to learn more, to go to the FLCCC website and look at the FLCCC recovery protocol. There's one for long COVID, there's one for Long-Vax. They're really pretty much the same. And everything is researched, everything is explained in detail. We didn't just pick all of this out of the air. But yes, in a lot of the recovery protocols, we do use ivermectin for 3 to 6 months. It's been shown to lower inflammation, it's immunomodulating, and it's been shown to help denature spike protein. And then I think everybody, whether you were vaccinated, whether you had COVID, wherever you are in the world, needs to focus on the basic things, really, which don't cost anything. And that's a low inflammatory, non-GMO diet. Gosh, I don't know why it's so hard for us to change what we put on our plate, but is crucial. You could be on 15 supplements, but if you don't start there, I'm not sure how effective those supplements are going to be other than draining your wallet. So,
Right.
And we strongly recommend in patients that it is appropriate. Not in pregnant women, not under age 18, but is intermittent fasting. There was a senior scientist at the Institute of Aging named Mark Matheson, and he said at one point, if we all instituted intermittent fasting at age 50, we could delay, and Dr. Gazda would say, we could prevent the onset of neurodegenerative disease. So diet, of course, intermittent fasting, exercise is key, although many of these patients have struggled with exercise. So we do light stretches, we do yoga, reducing stress. We live in such a stressful world. Clean air, clean water, and sleep. Sleep is crucial for getting whatever got into the brain during the day or during the nighttime for that garbage collection to occur at night. And then there are some key supplements. We go through those in detail. Now we have a brain recovery protocol. We are just adding an additional 10 things. And then we'll keep adding more, because people really have, unfortunately, there aren't enough doctors like you. Oh my God, we need to clone you times 50 million times. But patients are going to need, we all need to know what are the basic things we can be doing at home every day.
So you really touch on some key aspects, and regardless of what kind of chronic health situation you're dealing with, it does get back to implementing some healthy fundamental lifestyle factors. Sleep, healthy diet, exercise is tolerated. A lot of it's, when it comes to diet, it's not only what you put in your mouth, but what you don't put in your mouth. That makes a big, really important. And I've often commented that no amount of supplements are going to overcome a lousy diet. So it's just going to drain your wallet, which I think is perfect, as you described. What do you make of some of the programs out there, or some of the supplements that are really kind of targeted towards breaking down the spike protein? You mentioned ivermectin has a role. I know bromelain, N-acetylcysteine is part of those aspects too. So what's been your experience with those?
I like both of those. There's an NAC that comes from Italy, and it's called NAC augmentata. Their studies have shown that it denatures spike protein by 90% versus the regular old NAC by about 20 or 30. But the problem with Augmenta NAC is it's really expensive. I mean, it's $100 for a bottle versus good old NAC is certainly a lot less expensive. But we need more. We need more things that will denature spike protein, ways to lower inflammation. We upregulate autophagy or autophagy. I don't know how you say it, but if we can help the body eliminate things that we don't want or need anymore, that can also be helpful. So some key supplements that there are many, all the flavonoids, resveratrol, quercetin, luteolin, methylene blue, all can help with our body with increasing our mechanisms of getting rid of things. So those are some of my thoughts.
Do you know if those products, and I don't remember, ivermectin has a number of mechanisms, but is the degradation of the spike protein primarily from those other products? Has it been looked at as, is it the spike protein that is now being expressed on the cell surface after it has been induced into production through the ribosome? Or is it spike protein that is within the cell, like the cytosolic space of the cell? Do you have any thoughts on that?
Oh, I don't think we have any idea.
Yeah. Okay.
I don't think we know.
So the other aspect is what can be done to try to prevent the spike protein from being produced in the first place? Because if it is persisting, right? So it may be in circulation, but if it was just being induced into production one time in one event, and it's in circulation for a while, well, eventually over time, the level is going to drop and eventually disappear. What appears to be happening, even in people who aren't getting boosters, is the perpetual production of it. So it's getting produced somehow in the body consistently. And that's the other challenge. The question is where is that coming from? I think, Suzanne, that it's very possible a large reservoir of it could be coming from the gut. I remember early on in the pandemic, there was this discussion about the SARS-CoV-2 finding its way into the gut, and they were actually detecting it in the digestive tract. And I thought, well, that's interesting, because if it's making its way to the gut, there's always the chance that it gets reabsorbed, or whatever components of it can be reabsorbed. But if now the microbiome is somehow producing it, and why wouldn't it if the stuff goes everywhere, right? If it's being distributed throughout the body, you could basically turn any cell of the body into a spike protein factory.
Yes.
So another aspect to this, another angle to this from the standpoint of is trying to reestablish a normal, healthy microbiome as best as possible. And that, again, comes back to the fundamentals of good, healthy diet, et cetera. So it can't necessarily just focus on one thing. It has to be this comprehensive approach, which is, I know what people are working on. I know it's what the FLCCC organization is working on. It's what many other people are working on, is, you got to pull the lens back and say, okay, how can we attack this from multiple areas, and what can people do to empower themselves? And that's the whole point. That's the whole point of this conversation, other conversations I do, and I know the work you do, is people need to become empowered in this process to know that they can do some things on their own. And it does, again, come back to those fundamentals of what you mentioned. I'm curious, in your practice, in doing this, right, through lifestyle, diet, supplements, ivermectin, whatever, do you have a case or two of some people who are turning around, who are actually, getting better with the implementation of these strategies?
Absolutely. Many patients do get better. It takes a long time. It's usually, 3 to 4 months before we really start to get a foothold. And there's a lot of hand-holding and encouragement that needs to come along with it. And I've also seen people that get better, they say 90% better, and then they relapse. It's almost like some of this becomes a relapsing, remitting disease. And it may be something triggered their immune system again, or maybe it was exposure to COVID. It could have been exposure to spike protein. So these are patients that we can help. And that, again, like I said, we just need to follow over the course of time to assure that we are doing everything to optimize their health. And I would also add that it's time for an open discussion, that I believe the answers to long COVID and COVID vaccine injuries are not going to be found in academic centers, that we have to have open communication between physicians on the front line, like you and me, that are seeing this every day, that understand the disease, and those in our university settings. And that my firm belief is that the majority of the answers lie, Kurt, through integrative medicine. Yeah,
I would 100% agree. Where can individuals who are struggling get more information?
Again, I refer you to the FLCCC website. So much information there. Please look into that. That should be your source. React 19 is another organization that has done great work. It was founded by 3 vaccine-injured individuals. On their website, they house all of the, what is it now, almost 3,000 studies talking about vaccine injuries that have been in published peer-reviewed literature. So they too are another organization that you should look to and support as well.
Excellent. Well, Suzanne, thank you so much for all you do, the hard work you put into this. I know you've been out there for a number of years doing this, and your work also with the FLCCC, which is very important. So looking forward to more discussions in the future and collaborations.
Thank you so much for your time today, Kurt. Thank you for all you do.
Thank you.
You've been listening to the Functional Medicine Doc Talk podcast with Dr. Kurt Wohler. For more information about this podcast, go to functionalmedicinedoctalk.com.